Hi, I'm Amanda Cranston. I'm the occupational therapist at Cornerstone. I'm also over the lymphedema and oncology program, and I'm based out of the Arden location. So this is the last in a series of 4 videos in relation to breast cancer for Breast Cancer Awareness Month. You missed the first 3. The first one was on living an active lifestyle. The second one was on lymphedema in relation to breast cancer. And the third one was on if it's normal to have pain after breast cancer treatments. So this one, along with the previous ones, we're hoping to give you information and talk about various topics to help you, a loved one, a friend, someone that you may know, feel healthy and confident after breast cancer treatments. So this video, we're specifically talking about motion. So your ability to mostly move in your upper torso here, but also your hips, anywhere else that might get stiff. So is it normal to experience loss of motion and stiffness long term after breast cancer? Quick answer is no. So 43% of people who did not receive early intervention, which means treatment pretty much right after you've had surgery, continued to have loss of motion 5 years after the finishing of their treatment. This is compared to only 9% who did have that treatment right away. So what contributes to this immobility or the lack of movement? So being sedentary, so not moving as much, you're not want to move, you don't feel good, and you might have poor posture because everything kind of, if you've had mastectomies, even a lumpectomy, you want to protect that area. So you kind of hunch over a little bit, which if you can even see me, if I'm hunched over, I can't raise my arm up very high. So joint stiffness. Did something become stiff? Is your shoulder blade not moving on the back of your torso? If that doesn't move well, your shoulder also can't raise up as much. Are things tight? Are your pec muscles tight? Are the tissues on the side tight? Do you have a lot of scar tissue? Or do you have that axillary cording, which was discussed in the previous video? So sedentary period and postural influence. So you've had recovery time and you've been upright less. You've been slumped over, which leads to stiffness in your back. Your neck could be tight and stiff from, kind of sitting here like this. If you're sitting more, you're hunched down more, your hips might be tight. You might not be able to stand upright, and it's hard because now things are weak. So this is it kind of affects your whole body. It's not just something that's going to affect the upper portion of you. Types of stiffness. It could be in your joint, in this actual shoulder joint, like I said earlier, the way your shoulder blade moves on your back into your spine and on your rib cage. Your ribs, they might not expand the way they should. Your cervical, lumbar, thoracic spine. Are you now hunched over? Or your hip might be stiff. Types of tightness muscle. So your pecs, you've had some trauma to this area. Your hip flexors from kind of maintaining in the kind of bent over posture. If you're sitting a lot more, you're not up and moving, your hamstrings might be tight. Or up here in this upper part of your neck from being kind of slumped over. Some common muscles that might be affected after breast cancer surgery. So, of course, your pec muscles. And you might not feel this in that specific muscle group that's impacted, impaired. You could feel it down your entire arm, into your wrist, your hand, and think that you have injured your hand, you have carpal tunnel, and that might not be what it is at all. Scars. So scar tissue, whether you've had a lumpectomy, a mastectomy, you have this scar and it might adhere down. So if that tissue is not moving very well right there, you're not going to be able to raise your arm up very high. It's restricting it. Axillary Web Syndrome. So essentially this is just a tight, fibrotic lymphatic vessel that it becomes stressed and it causes these tight bands in your arm, and it's very painful. It's hard to move. It doesn't allow you to move it up because it's so tight, and it can be feel that tightness and restriction all the way down into your thumb. So how do we address it? If it's a posture thing that's making you not be able to raise your arm up, if you're sitting here like this, we need to be able to get you upright, because if you can sit upright, my arm moves a lot more than if I'm down here. Are your muscles tight? We do manual interventions for that, joint mobilizations to help lengthen and move those areas that are restricted. And axillary cording, we do some manual lymph drainage to help de-stress your lymphatic system and get rid of that tightness in your lymphatic vessels. So this is the last of the series here, and we want this video and the 3 prior to be as a resource for you. And we want you to know that we're out there, we can help you. And if you have any questions, please feel free to email me, and if I don't know the answer, I will find someone that does, so we can get you the help you need.